Okay, let's talk about Sjogren's syndrome. Sjogren's syndrome is an autoimmune disease, but it's quite common relative to other autoimmune diseases. It's inflammatory disease. Um, what what it causes? It causes dryness in the mouth and the eyes, but also it can cause more generalized disease that can cause many things like vasculitis, and you will see that it can also affect the kidneys, the exocrine glands, but sometimes it is just causing dryness in the mouth, in the eyes, secondary to gland dysfunction in the eyes and the mouth. You can see that the pathogenesis is lymphocyte infiltration of the exocrine glands. Um, yeah. So it can cause a localized disease, but sometimes it's systemic. Merck says it's systemic, but we'll see that sometimes it just causes a sticker syndrome in the mouth and the eyes. Okay, there is a way to diagnose it based on criteria. We'll see it. There are inclusion criteria, exclusion, namely someone with hepatitis C or HIV can't be diagnosed with this, or someone that had radiation to the mouth or to the eyes. It itself may cause dryness, so we can't diagnose them with Sjogren's syndrome. What is the treatment? Usually it's symptomatic, but if there is a visceral organ involvement, you can see that you can treat with corticosteroid and immunosuppression. So it should be noted if it's localized or systemic. It can also be primary, namely no secondary autoimmune disease causing the Sjogren's syndrome, but it can also be secondary. It's 30% secondary to other autoimmune disease, and you can see the list: rheumatoid arthritis, lupus, systemic sclerosis, blah 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 blah. Genetic association, sometimes it's connected to HLA-DR3. Okay, but they don't use it for diagnosing. Pathophysiology, we said it's lymphocyte infiltration. You can see B cells, T cells in the glands. It affects mainly the glands, as we said. The infiltration causes inflammation, which disturb the glands, which causes the secretory problems and dryness in the mouth, the eyes, exocrine pancreas can be damaged. It causes atrophy. Therefore, the glands doesn't work, which causes the dryness. Okay. Symptoms and signs mainly xerosis or xerostomia or dry eyes, dry mouth. This is the major manifestation of the disease, which can cause many problems. Yes, in the eyes it can cause keratitis, superficial conjunctivitis, or things like this. In the mouth it can cause candidiasis, it can cause tooth decay, because the saliva is important for the tooth. It can also cause calculi in the salivary ducts. Okay. When we look at the parotid gland of those patients, it should be enlarged, asymmetric enlarged. Note that there is differential diagnosis for parotid gland enlargement, like mumps and things like this. Extraglandular manifestation, arthritis may be in some patients. You can see it's about 30% patient with arthritis, but arthralgia is present in 50%. Arthralgia, namely pain in the joint, and arthritis is pain in the joint with inflammation manifestation like redness, swelling, loss of range of motion, the signs of arthritis. Okay, you can see other manifestation of Sjogren that is beyond the glandular dysfunction. You can see Raynaud phenomena, Raynaud syndrome, interstitial lung involvement, vasculitis. Pancreatic insufficiency is secondary to the glandular insufficiency. Peripheral polyneuropathy and multiple mononeuropathy, namely nerve damage. Renal tubular acidosis in the kidneys. even non-Hodgkin lymphoma is more common in those patients. It's said in 40 times the normal rate. Diagnosis: clinical criteria, eye and salivary gland testing, and it must have one of them. You can't diagnose someone with Sjogren's syndrome if he doesn't have any eye and mouth dryness. Autoantibodies, we will see that it's not much of specificity or sensitivity to the disease, and salivary gland biopsy is quite rare. It's not the way to diagnose usually. Okay, so there is a classification criteria of the Rheumatology Association. I know in order to diagnose someone with Sjogren's syndrome, he must have one of the two you see here: eye symptoms of dryness for 3 months or more, or oral symptoms for 3 months or more of dryness in the mouth. Plus, he must have a score of 4 points and more in the criteria you see here. You can see that it must have histopathology with lymphocyte infiltration, anti-SSA antibodies, what called anti-RO, ocular staining score, or Schremer test. Schremer test test how much tears we produce in certain time. Okay, you can see the criteria. Okay, so we need one or both and a score of 4 points or more in what we saw. And here's the exclusion criteria, what we said: someone with AIDS, someone with active hepatitis infection, someone with amyloidosis, sarcoidosis, Graves' throat disease, IgG4 related disease, radiation to the head and neck. They are excluded from diagnosing with Sjogren's syndrome. Okay, I won't go through it. Oh, prognosis. Usually, Sjogren won't affect the life expectancy of the patient, yet if it's systemic, it may. Also, the main autoimmune disease, the Sjogren may be secondary to it, may affect the life expectancy. That's what I can say. In regard to the treatment, symptomatic treatment are avoiding aggravating factors. For a more severe disease, you can use corticosteroid or rituximab, hydroxychloroquine, methotrexate for the joint pain. Okay, so we start with treating the symptoms of dryness with the eye lubricants and using a lot of water or liquids for the dryness in the mouth, like chewing gums. Or hydroxychloroquine, you can see the dosage may be used for the musculoskeletal pain, for arthralgias, and methotrexate can also be given. Aggressive systemic therapy indicated sometimes if the systemic symptoms are quite severe. You can see the corticosteroid, the rituximab, and fatigue. This doesn't have any really effective treatment for this. And that's it. That's about Sjogren's syndrome. And if we can see the key points, is the manifestation of Sjogren in dryness of the glands, but also in the systemic manifestation like renal-tubular acidosis and peripheral neuropathy. Diagnosis is based on clinical criteria. Treat the Zika symptoms symptomatically, and if you have a severe disease, you can use corticosteroids and rituximab. That's all. That's about Sjogren's syndrome for manual professional addition. You can look it up in the internet for free. Thank you very much, and that's it. If I had any mistakes, please correct me. That's all.